Did you realize that about 86.5 million Americans have some kind of heart disease? And about almost half that number are age 60 plus. Now, if you're age 60 plus and you fall into that category, but you still want to live at home and be comfortable and know that you're well cared for, you might want to consider a home care agency that specializes in cardiac care. So we're going to talk about that today, so stay tuned. Okay, good morning, everyone, and welcome to Scan FYI. First of all, I just want to say that today's episode is sponsored by Jersey Memorial Group. My guest today is Howard Stein, and it is, Howard, always a pleasure to see you, whether in person or on a Zoom square.
Hi, Andrea. How you doing today?
I'm doing great. So, Howard, you are the owner and operator of Home Helpers, and so why don't you tell everyone a little bit about yourself and your role there, and then we'll get into why we are talking about this today.
Awesome. So yes, I'm the owner of Home Helpers Home Care. Just by a little bit of background to set some context, prior to me owning Home Helpers, I worked for Aetna, and they had a care management and communication platform as part of population health. And there was a huge part of that was health and wellness. And there was also a huge part of population health being that cardiac disease is such a killer for Americans. This was a huge focus of the program. So taking a lot of elements that I learned over the years in my previous career, specialization and specialty programs became really important for Home Helpers. And this cardiac program is one of those ideas that came from my experience.
All right, so first I just want to remind everyone that all of Howard's contact information are going to be in the comments if you want to reach out to him after this. And you know, Howard, I guess that's the thing that sets something like Home Helpers, Home Care Helpers apart from other organizations, because you have really developed a specialty area here in caring for cardiac patients.
Yeah, and we think that is super important. I mean, we all know that heart disease is the leading cause of disability,
Yes.
constrained activity, and diminished quality of life for Americans. So, of course, this is super important, and especially for the population aged over 75, where then other comorbidities come into play and it becomes more of a chronic situation. And, you know, we want to be in the business of first being preventative, but also being able to help out when things are serious, or if there is a post, surgery type of situation, anything like that, where, heart disease is involved, we can assist and not only have better outcomes, but improve quality of life. And that's really what the kind of the core goal of home care is.
Thing is that we all want to age in place. We want to recover in place. But in order to do that, you can't just necessarily, I would say it's true that you can't just necessarily go home after a huge, let's say you have heart surgery, unless you've got someone at home who's trained and prepared to, care for you in the way that you need to be. And just having a teenager come in, which I know some people do, I don't think that's going to cut it, right?
Not in my opinion, definitely.
No, mine either.
Definitely not. I mean, especially, recovery. So if you've been hospitalized or had a surgery, any type of cardiac surgery, you need discharge support. You want to make sure that, whatever agency you're working with has participated in your discharge plan, right? That's first and foremost, right? So they understand how to take care of you when you come home, that you can come home to a clean house. If there's pets in the house, those pets are taken care of, that you have all your medications ready for you when you come home, and that you have a general plan right?
Yeah,
On day one of when you come home, when you're in a recovery phase, right? Post rehab or post hospitalization or post surgery, even if it is an outpatient surgery, a lot of times for our aging loved ones, especially those, 75, 85 plus, this becomes a real issue to manage by themselves, right? That's really where the value of home care comes in. And especially if there's a family that's, not around the corner, right? They need that support, they need that help,
right.
even if just for the short term, right? If the wellness goal is to get back to independence, right? Which in many cases it is, this is a short term um, a program where the goal is to get that person back to independence, and we work like that all the time. And we want to help in all of those types of situations.
So as a cardiac specialty service, what obviously your folks are receiving some special training?
That's correct. And so not only is there the regular, home health aid certification, but we're continuously training our caregivers 10 hours annually on average, plus specializations.
And so if all right, what are the kinds of things that in the cardiac specialty service that you could expect if you needed to reach out and get this care?
Well, we would break it down into what condition phase the patient is actually in, and that would be either preventative, recovery, or ongoing support. And based on what those needs are, we would tailor a program. We talked a little bit about recovery, but if you think about ongoing support, right? What could that
Yeah,
look like? So maybe
right.
that's monitoring. So that could include things like pulse oximeter, blood pressure, weight, right? Nutrition program, hydration program. Those are kind of core. Then you get into things like medication reminders. And then, of course, all of the other kind of support programs that come along with home care, like personal care, housekeeping, assisting with physical activity, or helping support PTOT, which is also key in the care continuum. And then things as simple as companionship or making a meal, right? And then making sure they get to their appointments for cardiac follow-ups on time and safe.
So it's a person who's trained in home care, but plus. This is
Correct.
really, this is all above and beyond a basic home care helper.
That's right. And
Yeah,
there is a little bit of a premium for that. But if you think about all of the conditions, especially the chronic ones, when you get into things like Alzheimer's or stroke, right? Or any type of recuperative care program, which, this cardiac would fall into something like that, depending on the situation. All of those require specialization, requires experience, requires that nursing supervision in order to get to the outcomes that we want. And as you know, I always like to talk about the care continuum, right? But those support partners are key in this also. If I have a relationship with that vascular doctor, right, that PTOT, right, all
right.
of those things come together so that the client, the patient can have the best outcome and can achieve their wellness goals. That's what this is really designed to do.
And, of course, something that I love is that, well, you're home, you're staying home because we all want to look, we want to go home. We have surgery, whatever it is, we want to come home. And in order to be home, sometimes it's going to require some additional care. But this is, and you say it comes with a premium, but isn't that better than having to go to a rehab? Now, there might be a time when absolutely you have to go to a rehab, and
Mhm.
I totally understand that. But staying home and being safe
Yeah. So
and
I
knowing
always,
that under a watchful eye, that's I guess what I want to say.
yeah, I mean,
Yeah.
we always encourage the rehab stay. So won't be a situation where we would tell someone in general to come straight home. I think that rehab visit is always best if we can encourage that client or patient to do it.
Right.
And then get them home safely. So that I would just say, want to clarify on that.
Oh, yes,
But
yes.
I also think there are a few other things that we can do to ensure safety, even if we aren't doing a live-in or there for 12 hours a day. We can add things like 24-hour monitoring with automatic fall detection. So we can put a device in the home, basic things like that to extend care, even when we aren't there, right? Depending on the circumstances and depending on the care required, is really what that initial assessment helps us determine. And then we're always evaluating, right? People get better and sometimes people decline, right? And we have to make adjustments based upon that. But there are a lot of variables that go into the care plan, but there's also a lot of choices in terms of how we can manage our care and what tools, technology, programs we can use to ensure the best outcomes for our clients.
So I always feel like one huge advantage of using an organization like Home Helpers is that, well, you get you, Howard, and your whole staff and all the expertise. And so it bothers me sometimes. Because I do, know some of my friends, and I live in an adult community. And I see that they reach out to grandchildren or, young people, that high school students and whatnot. And I just don't feel like that's necessarily the right thing, the best thing for your safe care.
Well, you won't get an argument on that from me. I mean, the thing about working with a home health agency like mine is you're getting an agency that's licensed, bonded, insured, right? We
Yeah.
also are accredited, right? So we have an accreditation review every year, right? So there's a very high level of standard here that we have to adhere to, right? Then put in the nursing supervision, right? And we have wonderful nurses, not only a DON, but our field nurse supervisors that go out. We're making 30-day calls and 60-day visits, but it's also culture. And it's also employees. And I like to say we have a culture of care and caring. And that, I think, is what you're picking up on, Andrea. I really appreciate that. But I know our clients appreciate it also. Last year, we got actually 2022 and 2023 Home Care Pulse Best of Home Care Provider, right? We also got Best of Home Care Employer. We also got a Caring Star and a brand champion from our franchise. So the things that we do,
Wait, let me just say, I'm sorry I don't have an applause button, but
well,
there you go.
Thank you. But we say that because we're proud of it, number
Yes,
one, but
you
also
should
we
be.
want to let people know that we take their care seriously. We are professionals and we really want to help. And we also want to surround ourselves with the best providers in the community because we are in a community care model. We work in the
Yes.
community. We really embrace our community partners like SCAN for that reason, right? We know each other well, Andrea, because we've been working in the community together. And that is really an important ingredient in this when we're dealing with members of the community, especially our aging loved ones.
And when people, interesting that people do call SCAN periodically. I shouldn't say periodically, just about every week calls come in asking us as though we are a referral service. And of course, we do refer people to our community partners that we know because, well, we know them. We are not really a referral service, but because we also work closely with our community partners. So we feel it gives us some good insight into who's the right person and maybe who's not the right person. So
yeah, I mean, I think you guys provide an amazing education programs like this, as well as all the programs that you do in your facilities. Those are wonderful resources to people.
Well, thank you, Howard.
And that's why you get those phone calls.
We're about public education. And, even here right now, as you and I are speaking, I know there are other, of course, there are other home health care agencies, and depending on your specific needs, if you do need specialized cardiac care, this is obviously why I feel it was important to feature home helpers, because not everyone offers that same level of specialization. You want to make sure, this is all about being prepared. We always say knowledge is power, and we like our audience to know what is available to them. And so some people say, well, I don't need this today. Fine, you don't need this today, but I don't know what the future brings, either do you. And because heart disease is the #1 killer. Sadly, we've not always learned our lessons in this country. You might need this care sooner rather than later. You might have a friend or a relative. And so we want you to know who the available resources are so that you will be able to reach out to them for absolutely the best care possible. And that's why we do Scan FYI.
Thank you so much, Andrea.
In
That's
a
awesome.
nutshell. In a nutshell. Well, Howard, is there any final words that you would like to add today?
Yeah, I think the one kind of thing that I would say and want everyone to really get out of today's conversation is that, especially for the families of those aging loved ones, right? If you notice something early, get it checked
Yes.
out, right? So that proactive approach, keeping in touch with mom or dad or grandma, grandpa,
Right.
checking in on them, making sure they're okay. And when you actually see something, when you have that observation, let's take action on that, because the worst thing that can happen is if we don't take action and then there's a consequence for it. Often people call me when something becomes an emergency rather than when we can get involved early on and maybe, just it's not going to be as drastic. Maybe it won't require a hospitalization, right? That's the important message. So if you feel something, if you have that intuition that something just isn't right, it's always best to get it checked out, not only because it's the right thing to do, but also for peace of mind. And I would want to encourage everyone to kind of take that tactic when it comes to our aging loved ones. I think that would be a great benefit to them, even though they may not want to do it at that particular moment. They're going to thank you later for it, and I'm sure they'll appreciate that loving care that you went that little extra mile to push them to get that attention or care that they needed.
If you see something, say something.
That's right.
It's true. And by the way, even in yourself, if something doesn't feel right, please make sure you check it out. Take good care of yourselves.
Absolutely.
Okay, well, Howard Stein, thank you so much for being my guest today on FYI. I appreciate all this good information. Again, reminding everyone, all of Howard's information will be in the description if you want to reach out to him.
Bye, Andrea. Thank you so much.
Okay, so our episode today was sponsored today by Jersey Memorial Group. And remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone, and bye, Howard.